Hello and welcome to our 5 on 5. I'm joined today by Jackson County Health Director, Dr. Leona O'Keefe. Thank you so much for making time to talk to us today.
Of course. Thanks for having me.
Now, you're taking over for a long time, Jackson County Public Health Officer, Dr. Jim Shames, but I believe you've worked together before. How does that aid in your transition?
Yeah, so I was previously Deputy Health Officer for both Josephine and Jackson County. So I rode through the Delta wave in the world of public health. So I do have exposure to the people that take part in taking care of our community through this, and had the wonderful opportunity to work with Dr. Shames as his deputy for the last several months and receive his knowledge directly that way. It's also nice. I already know many of the people on our team at Jackson County Public Health, so that helps make it a smoother transition.
Yeah, that's great. What resources? Now, you mentioned Josephine County. What's the biggest difference between Jackson and Josephine County when it comes to public health?
Oh, I think there's a lot of similar goals, right? We, in both counties, really want to take care of the community as best as possible, looking to find the gaps and how can we close those gaps so that more people can have a higher level of care. I think, Jackson County obviously is bigger, has more organizations to interact with. So that's a large part of what I've been doing in these first couple of weeks is meeting the leaders of those organizations and forming relationships there.
Absolutely. Now on to COVID, of course. There's a lot of misinformation out there regarding COVID-19. What advice do you have for the public about where they get their information?
Yeah, this is really hard these days with internet because you can go to a website that looks very trustworthy, and it turns out there's a lot of websites with very scientific sounding names that are fake. So how do we deal with that? You want to confirm that this is a real website. Check out the things that they're saying. If they're making a claim based on a study, then go look at that study. Make sure it's a real study. Make sure that what your site is saying this study claimed is what the study actually claims. When you're hearing things from other people, whether it's through word of mouth or on social media, again, confirm that what they're saying is accurate by going to that site and checking it out yourself. There are places you can go to as well in the public health world. You could Google for public health misinformation, and they list a lot of these common misinformation pieces that we're hearing about and tell you what the facts really are. And you can also go there and report something you've heard yourself so that they can investigate it and help you determine whether it's true or not.
Great tips, great tips. We'll be right back after this break. Welcome back to our 5 on 5. We're joined by Jackson County Health Director Leona O'Keefe. We were just talking about COVID-19. Now, specifically regarding the Omicron variant, what do people need to know?
Well, not to sound like a broken record, but our guidance is the same as it has been, but perhaps more amplified because Omicron is spreading much more quickly than any variant we've seen so far. And that the reasons for that are very multifactorial, but the way to protect yourself remains the same. If you haven't gotten vaccinated, please talk to someone about that and consider starting the vaccine series. That's the most important thing you can do to protect yourself and those around you. If it's time for you to get your booster, get your booster. Get tested if you're having symptoms. Stay home unless you're really, really sick and need to go to the hospital, then seek care. Wear a mask and consider upgrading to the next higher mask available to you. Rather than cloth, a medical grade. Or if you've been wearing a medical grade, then even the N95 or KN95s would be great. And prioritize your social engagements. Which ones are the most important to you? Keep those. If you're not interacting with someone high risk, make sure you're in a space that's well ventilated and really limit those interactions as much as you can while still trying to live the life that you desire to lead. That's where that prioritization comes into play.
Absolutely great advice. Now, OHSU says the Omicron peak at Jackson and Josephine County hospitals will be in early February. Is there anything the county can do or is doing to help our hospitals in the next month?
Yeah, one of the biggest things that we're working on is a large number of patients who are waiting in the hospital, ready to leave, but don't have a safe place to discharge to, whether they don't have help at home or there's not a home health agency available or there's not staffing in the long-term care facilities to take them if they need a little extra help beyond what's available at home. So we are working very hard, multiple groups of us, to figure out how we can boost the staffing in those areas, get the patients to where they need to be out of the hospital, which then would open up beds for people who need to get into the hospital for that acute level care. That's the biggest thing that we're working on. And just like everywhere, every industry throughout our country, staffing is a huge need. So we do have help locally working together, but also from the state and at a federal level to get that staffing available.
All right. Well, thank you so much for your insight and your expertise and making time to talk to us today.
Of course. Thank you.
We'll be right back.